Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. This is PACE Month. What is PACE? PACE is the program of all-inclusive care for the elderly, and it is the month we're celebrating PACE. So I thought we would have someone talk about PACE who knows everything about it. It's my friend Alan, who is with San Diego PACE. Alan, how are you doing today?
Hello, Brian. I'm doing really good today. I'm really happy to be here with you. Thank you for inviting me. Thank you for letting me have this conversation with you and sharing a little bit more about the resources that San Diego PACE has for the community here in San Diego County.
Excellent. I really appreciate it. I've always been impressed with the different presentations you've done in the networking groups that we both are part of. And so I thought it would be great to have you share more about specifically San Diego PACE. San Diego PACE is part of San Ysidro Health. Tell us about San Ysidro Health.
Of course. So kind of going back with the mission of San Diego PACE of helping those that are in need, San Ysidro Health is an FQHC, so it's a federally qualified health center, and it's our parent company. They started in San Ysidro with a couple of founding mothers. They decided to open up the clinic because there was no services in what was considered rural San Diego back then. And they didn't have anywhere where they can go and get their services rendered. The closest clinic to the community in San Ysidro was in La Jolla. So that travel was huge. There was a lot of limitations for them to access health services, and that house opened in San Ysidro, and it's become one of the biggest FQHCs in the country. So we're very happy about that, and we're very happy to serve a population that really needs it.
Great. So tell us in a nutshell, what is PACE?
So PACE is a program of San Ysidro Health. Basically, what PACE is a program of all-inclusive care. PACE is a nationwide organization or initiative. It started in San Francisco, and the reason why PACE was started was because we realized that there was a lot of people that needed the extra help aside from the primary care services that they would regularly get rendered. We realized that there was a high utilization, there was a high readmissions rate, and there was something that needed to be done to provide a more preventative measure of care for those that really needed those services, right? Those that were getting discharged to the home that didn't have that extra support, those that didn't have the ability to take their medications on their own. So the PACE program was created, right? And San Ysidro Health adopted the PACE model in 2014. We opened our first center in 2015 in San Ysidro. And ever since, we've been growing exponentially, even through the pandemic. And I think that one of the biggest, catalysts of our success is the need for the services, right? And one of the biggest limitations that we have to continue to grow the program is the lack of knowledge of the services that we have, right? So opportunities like this to chat with professionals like yourself really gives us a platform to be able to reach a wider audience, let people know that they qualify for services like this and that they can tap into resources that can provide them an all-inclusive approach to their care.
Got it. So unfortunately, you have a lot of seniors who are living at home, trying to live independently, and maybe they have a medical issue, they go to the hospital, they are cured or whatever the situation is, they go home, but something happens, they get readmitted back to the hospital because maybe they weren't, their medical needs weren't exactly met, or they're not getting some of the support that they need to rehabilitate or what have you, and then they're back readmitted. And that's super expensive for the hospitals, and so it costs millions of dollars on the system. So PACE really can take care of that.
Yes, definitely. And I'll give you a quick example, right? You brought it up perfectly. If there's somebody that's getting discharged from the hospital that doesn't have the support back at home, they might be discharged to a SNF, get a good quick rehab, and then sent back home. But when they get back home, they still don't have the durable medical equipment. They still don't have the grab bars. They still don't have the wheelchair, the things that they need to be able to thrive independently at home. So what happens, they have another fall and they go back to the hospital system, right? So what we do is that we go in there, we do a thorough assessment. The beauty about the PACE program is that these are individualized assessments. They are made for the person that we're seeing. We capture all of their medical needs. There's a few assessments that go on when they're onboarding onto the program. But once we get those assessments out of the way, we truly know what that particular person needs to be able to stay healthy, safe, and independent in the community. So we fill in those gaps by providing physical therapy, by providing durable medical equipment, caregivers at home, and truly anything that is medically necessary for them.
So it's very different than just someone having a primary care doctor.
Yes.
You replace the primary care doctor and then some. It's everything beyond that. And I've toured the new PACE Center in Vista.
Yes.
It's amazing everything that's there. I mean, you have all the medical facilities, the big room where people can meet in, the smaller rooms where people can get counseling services. Truly all inclusive.
Yep. It's an all-around plan, and we truly, the Vista site is the culmination of all of our efforts. We've been in the industry for about 7 years, and learning along the way, right? What do our participants need? What do they use the most? And Vista is just an all-encompassing facility, and we like to use the word one-stop shop, right, for all of our facilities, because truly anywhere that you go for PACE, any facility that you go is going to have the basic needs that you could use, right? So labs, counseling rooms, they have observation rooms, we have therapy rooms, we have a day center where they can socialize and, get rid of that isolation that the pandemic brought on a lot of people, right? So a lot of people have been isolated, and that's a huge impact on their health. So we bring them back into the socialization component of the services, and it really helps them and motivates them to get better.
Who is eligible for the PACE program?
So the PACE program eligibility is pretty straightforward. We have to have 55 years or older for that particular participant. They need to be living safely and independently in the community. They have to be living in one of our zip codes, which is 114 all throughout the county. We cover all the way up to Fallbrook. We cover all the way south to the San Ysidro border and all the way east to Campo Jacumba area. And they have to qualify for a need of skilled nursing facility level of care, right? So they have to have some sort of medical condition that's going on that we can help mitigate, right? So if they are experiencing, diabetes, right, and they're not taking their medications, and that's creating constant hospitalizations, then we can go in there and help them with that. We can go and help somebody that's in that situation that's a little lighter, and we can go help somebody that's a high utilizer, right? That's somebody that's constantly going into the hospital system without a clear plan to stay home. And with the desire to stay home, right? We want to help people stay in the community. We want to help those that really want to stay connected to their home, be able to stay where they want to be, right? And recover in a place where they feel comfortable, right? Skilled nursing facilities are amazing. They do a great job, but they're modeled more towards the hospital system than they are towards a community-based program, right? We help them in their home, we help them in their community, and those connections that they have already established really help them get better. They support their recovery.
Got it. Yeah. And when PACE was started, I know it was considered more of like a Medi-Cal type program. Mm-hmm. I know the rules are changing now, where more people are going to be eligible.
Yes. So traditionally, PACE has been considered a Medi-Cal based program. We do take Medicare folks, but there's a share of costs associated with only having Medicare. If you have both Medi-Medi, there's no cost for the program. If you only have Medi-Cal, there's no cost for the program. But Medi-Cal laws changed significantly May 1st. So starting May 1st, people can now have $130,000 in the bank, plus $65,000 for each dependent. First home and first car are not included in that asset test. And it gives a lot of people that had savings the opportunity to access Medi-Cal programs that can help them. And there's a common misconception that's out there that Medi-Cal is lower quality services, and that's not true. Just to give you an example, we at PACE, we contract with private doctors that have their private practices, and we are able to provide PACE participants those services. So not because you're going into a Medi-Cal based program means that you're going to get lower quality services. We're out there doing our best to be able to provide the highest quality care for you and your loved ones.
And again, like the one in Vista, there's food and nutrition services. There's a little bit of a barbershop there as well. So it's basically everything that people need to kind of lift them up.
Yes.
Within the community. If someone wants to get started rather with the program, how would someone do that?
So the process is very simple. We have a general line that I'm sure is going to be posted at the end of this video. We can get a call from that particular participant. We process them through our enrollment department. Basically, or they can give me a call personally if they would like a tour or if they would like a facility kind of visit. I can definitely schedule that for them. But the way that process looks like is that we get a name and a phone number, we give them a call, we schedule an in-home assessment, right? And that in-home assessment is comprised of an enrollment specialist, a social worker, and a nurse. And we basically inquire about your medical history, right, and social service needs. So we will open your fridge, we'll go in there, we'll ask a couple questions in regards to your equipment that you're using. Are you having a hard time showering? Are there things that you can use assistance with? Do you need caregivers at the home? So we do a thorough assessment both on the nurse side and on the social services side. We get that application rendered, we send it out to the state. A nurse practitioner at the level of the state is the one that decides whether or not they're accepted into the program or they qualify for the services. Once we get the notification that they've been accepted, we'll notify them, we'll sign an enrollment agreement, and every participant for PACE becomes effective the first of the following month of enrollment. So we start the enrollment process today, September 1st. We can probably get them approved in 10 days, but they don't become active until the first of the following month, which would be October. So that's basically the process in a nutshell.
Got it. Well, and to get that process started, the information for San Diego PACE is on the screen, website, phone number, etc. Give them a call for yourself or for a loved one who you think could benefit from these services. So many resources available for our seniors to help them stay safe and independent in their community. Alan, thank you so much for joining me today.
Brian, thank you for your time. It's always a pleasure to see you out in the community. It's always a pleasure to connect with you, and we truly appreciate what you do. Every one of us that gets an opportunity to be with you, to be around you, definitely benefits from it, and we definitely wanted to thank you for all your efforts and everything you do for the community.
No, it's my pleasure. Got to keep the education going out there. We're all in it together.
Awesome. Let's do it.
You got it.
Have a good one.
Thank you.